Institute. Welcome to yet another engaging session of our scientific forum, We Talk to You. At Human Biologicals Institute, we take immense pride in driving several public health awareness initiatives through our one-of-its-kind platform, Puberty to Menopause. The sessions feature leading experts from across the country who share their valuable insights on key health topics aim to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Shalini Singh with us to share her expert perspective on women's health, teenage to old age. I shall be sharing more about our today's speaker in a short while. For a moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited, was established in 1982 by the National Dairy Development Board as of its unit and was later incorporated as a company in 1999. HBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine NTV. Our first manufacturing facility was set up in Uti. The facility is one of its kind in India and rolled out the country's first Vero cell culture anti-rabies vaccine in the year 2000. Today, we are a leader in the RAV segment with the presence in around 60 countries. HBI has launched several vaccines and been a major player in the human vaccine segment. HBI has been a key player of pentavalent vaccine to Government of India under its Universal Immunization Program UIP. In yet another milestone, HBI introduced Havishor in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults. Our vision of shaping global health by spearheading the One Initiative, our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We are committed to providing affordable, high-quality products through continuous technical innovations to meet our customer needs. As a market leader, we have a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging of our flagship brand Abhara. As a part of corporate social responsibility initiatives, we have adapted schools where IL provides infrastructure support and basic facilities, including assistance and with the midday meal program. In association with the NDDB, through the gift milk program, hundreds of school-going children benefit from daily milk nutrition. We have also donated an oxygen generation plant to Telangana Institute of Medical Science. These are very just few highlights of Indian Immunological Limited. For more information, please visit our website www.indiaimmune.com. Puberty to Menopause is one of our unique initiatives. We address a wide range of topics related to women, health, and well-being. Welcome to today's episode of We Talk to You. This session is dedicated to highly significant and often overlooked topic, women's health, teenage to old age. To help us better understand and its impact, we are joined today by Dr. Shalini Singh. Dr. Shalini Singh is a consultant for reproductive medicine with more than 15 years of experience in infertility. Dr. Shalini holds an MBBS and MS Obstetrics and Gynecology degree from India's premier institute, All India Institute of Medical Science, New Delhi. Ma'am holds a degree of fellowship reproductive medicine and ICOG diploma in minimal invasive surgery. Currently, ma'am is practicing as a consultant obstetric and gynecologist and infertility specialist in Ankura Hospital, KPHP branch, Hyderabad.
Good afternoon. This is Dr. Shalini.
Ma'am, am I audible? Yes, ma'am.
Yes, yes.
Sorry for the technical issues. Ma'am, please, today it's your like the topic is very interesting. It's women health and the puberty menopause is totally about the women health. And thank you so much for having us today, ma'am.
Thank you so much for giving me this opportunity and inviting me. Do we have
Ye-
attendance? I mean, do people have
Yes.
joined in or shall we
Yeah, no,
wait?
they have already joined, ma'am, and they're continuously joining. You can start your presentation, ma'am.
I can't see my presentation.
Uh,
Okay. So, women's health in a very short time. It's very difficult to take care of women health in 1 hour. So let's go very short, and I hope all the women of we have women of all age group, and we have men also who have joined us for this discussion. Women are equally important in the workforce and at home, and it's a collective responsibility to take care of our daughters, our sisters, our mothers, our wife, so that a country can succeed. We have 50% workforce in the form of women. So let's talk about them. So I'm glad that you have come, and I really appreciate the presence. So let's come to the beginning of a girl's life, that is menarche, which is the starting of her reproductive life. Before menarche, I don't think so there is much difference between girls and boys, but as the girl achieves menarche, means as she achieves her first period, a lot of changes do happen in girls, and as a society, as a family, we should take care of them. It's a very important event in a girl's life. A lot of changes do happen, and it's our responsibility that we take care of them well so that they develop into beautiful and confident women. So first, let's understand what is menarche. Menarche is when a girl gets her first period. It's where she has attained her puberty. But puberty does not start at menarche. It is the last event of puberty. Changes of puberty starts way earlier than menarche. The first change you may observe is increase in the height. Her breast changes, small breast buds come, then her change in her mental makeup, and finally is the menarche when she achieved. That means there's a final process in the beginning of her puberty. So 20, 30 years back, the average age for menarche was 12 to 13 years. That is the teenage. Most of the women got their period around 12 or 13 years. But change in our social circumstances, the menarche age has reduced from 12 to as early as 9 years. Now girls are getting periods as early as 9 years. I can't imagine how these small girls manage their periods, because they are so young, they are so naive. But this is the reality, and this is not abnormal. Now, the age of menarche has been reduced, but if a girl gets period before 8 years, it's time that you should consult a doctor. And if a girl does not get period up to 16 years of age, that also is something which is alarming, and we should consult the doctor. So, what should we do when a girl achieves her period? When we were living in our joint families, there were aunties, there were grandmothers, there were mothers who were doing the conversation. But now in nuclear families, there is no conversation, and what they hear from their friends or from social media is what they take home. So we should do the right conversation with these girls and educate them that what is a menstrual cycle. Second most important thing I see as a doctor is that most of the girls they present in the OPD with irregular cycles, some kind of vaginal discharge, and the mother is really worried. And they go through a battery of tests and they self diagnose themselves as PCOD. So let me tell you this very clearly that initial few cycles may be irregular. You need not worry. The circadian rhythm is still setting, and up till 19 years cycles may be irregular. So you need not bother about her, and you need not label her as PCOS or any kind of disorder. So we should be very careful when we label our young girls as PCOD and thyroid or anything. So we should give them time, and do not over investigate them with blood tests or ultrasound. Ultrasound in young girls less than 19 years is not indicated unless she is suffering from a very severe problem like very severe menstrual pain or very heavy menstrual bleeding. Heavy menstrual bleeding also may be seen because they often skip periods. So you need not bother about it and don't go for unnecessary ultrasound. You can just consult a doctor if there's something to worry about, but do not label them. So, first point is that initial cycles may be irregular, and we do not label young girls as PCOS. If there is any questions, you can ask me in between. So, second most important thing is teaching them about menstrual hygiene. First of all, telling them then what is menstruation, then teaching them about menstrual hygiene. When you live in a metropolitan city, you may think it is very, very normal. But let me tell you, in deep down the villages, girls do not have access to clean water to clean themselves, clean bathrooms, and availability of sanitary napkins. So, what's menstrual hygiene? First of all, is education, information, then availability of hygienic sanitary napkins, and safe disposal where they can dispose the used sanitary napkins, and availability of clean toilets and clean water so that these girls can change their sanitary napkins during the school. See, most important change which happens after menarche is that girls stop going to school because they don't have access to clean toilets and clean water. So, in Asian countries, especially in Asian countries, women stop going to school after they attain the menarche. That should be stopped, and menstrual hygiene should be taught in all schools. All schools should be ready with all that. So, when a girl enters her teenage, they face a lot of self esteem issues. So, as a mother, as a father, how can we take care of these girls better? First of all, is diet. Diet is very important. Iron deficiency anemia should be prevented. Their body is growing fast. We should provide their protein needs, their iron needs, avoid excessively processed food for these girls. Homemade food with good quantities of iron and protein should be provided. We should not go under the pressure that my child was forcing me, so I had to order food from outside. You should be strict with your children and so that they take healthy, homemade, and balanced diet. Second is physical activities. As I told, as the girl attains menarche, They stop going to school, they stop going out, they are restricted to home, and because of the social media they are just busy on Facebook, Insta, or anything. But we should encourage them to have physical activities, take encourage them to take up sports in any kind, uh, be it swimming, badminton, running, athletics, whatever it is, cycling. We should encourage them for physical activities like walking through the stairs, going to market without using any vehicle, so that their health is maintained. Why there is an epidemic of PCOS in young girls? Because there is faulty diet, and plus there is no physical activity. We hardly use our body, and especially these young girls, they eat the ultra processed food and they just keep sitting at home and they're losing their health. Menstrual hygiene has been discussed. Iron deficiency, very important and often missed. We often miss that these girls are deficient in iron. So make sure they eat green leafy vegetables. If they are non-vegetarian, they can eat egg, chicken, mutton, and protein requirements should specially be taken care. Very important is prevention of sexual abuse. Nobody talks about it, but we do see young girls who have attained menarche and been sexually abused by family members or in schools. So there should be an open discussion, and your child should be free to discuss that what is bad touch, good touch, and should be these facilities should be available. Premature sexual activity. Abuse is without consent, premature sexual activity may be without consent. So we should make them understand that what is consent, and premature sexual activity should be avoided. We should educate our girls. So very important point is puberty transition. As soon as the girl enters her teenage, as I told, cycle may be irregular. That worries her. So no cycles. Many girls don't get cycles on time. They can miss their period for 2 to 3 months. Nothing to worry. Weight gain, as I told, weight gain in the form that they have a very negative body image. As I told, social media very bad influence on these young girls, celebrities, and they think that this is the right kind of. They should be not be body shamed. They should be comfortable in their own skin and common, but should be avoided with healthy diet and exercise. To make healthy choices, educate them. Acne. One acne comes and they think they are PCOD, but it's not like that. 8 to 10 acnes are common and they are not diagnostic of PCOD. During puberty, all these signs may be suggestive for PCOD, but actually they are not, and it's a simple puberty. So, as I told, PCOS is an epidemic in young girls. Diagnose them and do not label them as PCOS until unless it is confirmed. So, very commonly used term, I have hormonal imbalance. But what is imbalance? So, as women, what is imbalance? Some hormones are high, which is insulin and testosterone, which leads to acne, weight gain, abnormal hairs. And the female hormones like progesterone or estrogen are imbalanced, which can lead to irregular cycles. So give them time, give educate them so that they can, and grow up, their cycles will become regular, but and they still have irregular cycles. It's time to the doctor. So coming to the vaccine of our young girls, HPV available, and we recommend all the girls to have HPV vaccine to prevention of. Boys are recommended to have vaccine. Ideal is to take the vaccine before onset of sexual activity, and all married women who are sexually active can take vaccine up to 46 years of age. But if you take that vaccine, the girl has to still undergo cervical cancer screening with the help of pap smear every 3 years. So even if you had vaccine, don't forget the cervical screening with pap smear. So coming to a woman's reproductive life. When she crosses her teenage, education is a very part now. And as the woman enters her reproductive life in her 20s, most common problem sitting in a clinic is unwanted pregnancies. Let me tell you, as a fertility specialist point of view, avoid unnecessary pregnancies. They do affect you in long run. Get pregnant whenever you want to be. Don't get carried up with emotions. Contraceptive methods are available. If you are sexually active and do not want pregnancy, meet a doctor, and a good contraceptive will prevent pregnancy. Family planning methods are available to both married and unmarried girls. So, girls, it is yourselves. Don't depend on anybody else. Come and meet the doctor and take a good advice. When should a woman who has crossed her 20 should see a doctor? First of all, is irregular cycle. Women do not have 30-day cycle. Some may have 25 days, some may have 32 days. So every woman is different. So don't think that only cycles are 30 days. So any cycle between 25 to 30 days is 35 days is considered as normal. But if your cycle is shorter than 21 days and longer than 35 days, then it's the time you. And very important message I would like to give you is that do not miss your period for more than 60 days. If your cycles are more than 60 days, that is not required, and there's a high risk of endometrial cancer, and you should get period once in 2 months. And if you're missing your period, please the correct diagnosis can be made. Third important thing is change in the cycle pattern. Sometimes cycle initially maybe 32 days, then slowly you see that the pattern has changed to 26 days. This change in pattern is also if your eggs are reducing, the cycle shorten. So be aware in cycle pattern. Be it shortening of the cycle or should be consulted with your gynecologist. Any period which is very painful, missing of school or missing of work should be consulted, and any pain during intercourse for the married girls is should be treated. Any heavy menstrual bleeding for more than 5 days should be consulted. Any kind of foul smelling discharge which is copious, any and or yellow color should be consulted with the doctor. And last of all, if you're married and you're planning pregnancy and you've not conceived after 1 year, then so coming to fertility, women are most fertile in, but now because of social pressure, work pressure, career choices, women are delaying pregnancy. Will not stop for you. So aging 20s, as you enter your 30s, your fertility is all right. So if you are in 20s and can have a baby, it's the best time to have pregnancy. And if you cannot have and you're 30, please be aware of your fertility, and chances of conceiving are declining as you cross 30s. So if you have not conceived in your early 30s and you've crossed 35, it can even be pregnancy above 35 can be sometimes very difficult. And there are increased risk of abortion to a woman who has conceived in her after 35. These are called advanced. There is increased risk of abortion, preterm delivery, increased risk of Down syndrome, uterine anomalies like fibroid, adenomyosis, endometriosis, disorders like blood pressure, sugar, women who conceive after 35. So it's your duty to conserve your fertility, and if you're not able to conceive, if you don't find a partner, then the choice is egg freezing. Social egg freezing is available and not a celebrity thing. So if you have any concerns that I may not get a right partner, you should not get married just because you are aging. No, you can freeze your eggs and choose the right partner on the right time. Eggs should be frozen in early 30s, when they are still good. After 35, preserving the bad quality recommended. So if you are in your early 30s and have no plans to marry, skill of egg freezing is going to give you results in the long term. Because women don't produce new and they are losing eggs every month. For women, fertility is time bound. Biology will always win. Science may not always win. If you have lost your eggs, even science may not be able to help you. Fertility preservation option is available and easily affordable, and sometimes it can be a life changing decision. So, coming to life, you may not be 40, but you will someday turn 40. You may have your mother or your sisters who are 40, and you may think I'm too young to get old. How does aging affect? It affects your bone, your brain, your gut, your sugar levels, and increase inflammation in your body. Women above who have completed their family, who are taking care of their teenage sons, still have contraceptive needs. I still get women who don't want to get pregnant, but they do get pregnant and they are really ashamed of that. But if you seek advice, contraceptives are effective. So, contraceptive needs for women above 40 is a reality. Not be ashamed, but you need to meet the doctor so that unwanted pregnancies can. So, very important part of aging after 40, osteoporosis, perimenopausal age. What is the average age? It is 46. So as soon as you cross 40, you are entering into a menopause. That is called a phase where you are about to get menopause, and that is period is called a perimenopause. So osteoporosis prevention should be started in early 40s. So if you are smoking, drinking, exposure to sunlight, regular exercise. Yes, we do understand there's a lot of social media advice on exercise, but what do you consider as exercise? Walking, good exercise, but not enough. You should do strength training. You should strengthen your bones and your muscles with weightlifting. Some amount of weight training should be given to the women also, and calcium supplement as recommended by the doctor should be taken. Another important do hide is urinary incontinence. Urinary incontinence means involuntary leak of urine. After childbirth, as the level of estrogen in your body is reducing, there is some weakening of the muscles in your and which can lead to leaking of 15% of women may face it this problem benign and may go away. But if there is a leakage of urine while coughing, sneezing, laughing, or when you are outside, you're not able to control your urinary stream, or you're not able to completely empty your bladder, or you're not able to reach the bathroom when you are full bladder, consult the doctor. Treatment is available, and options like pelvic floor exercise, Kegels exercise can be taught to the women, which can help them. Laser treatment is also available in cosmetic surgery. You can tighten these muscles and prevent urinary leakage. Drug and surgeries are also available. So, coming to the nutrients, nutrition, very important part. So, women, you are taking care of your husband, your family members, who will take care of you. You have to do it yourself. So make sure you take your supplements in the form of calcium, vitamin D, omega 3 fatty acids, fiber, very important part, folic acid, magnesium, and enough protein for maintenance of muscles. Coming to the cancer screening, yes, we all are worried about whether we'll have cancer or not. So if you're of breast cancer, ovarian cancer, or uterine cancer, this puts you in an averagely high risk of developing cancers because these are hormone related cancer. So screening starts for cervical cancer 1 years of age. So every 3 years, a sexually active woman should undergo a pap smear irrespective of their vaccination status. And if you are doing HPV testing, screening can be delayed for 5 years. So cervical cancer is preventable with help of cervical cancer vaccine and regular screening with pap smear, because we can the cells 10 years develops the cancer and time. Second important is breast cancer. The most second important cancer in women in India is breast cancer. And how what should you do? After 40 years, a routine mammogram every 2 years and screening monthly breast examination. Examine your breast, density of your breast. Annually, once in a year, you meet your doctor, and every 2 years, you go from a mammogram to for cancer screening. BRCA gene detection is available. Carrier screen for detection of cancer gene is also available and can be availed. Coming to the uterine and the ovarian cancer, there is no definitive screening guideline, but if you are having annual consultation with your doctor, a good pelvic scan for your uterus endometrial thickness and your ovary pick up early lesions, but they may not be any symptoms and may be completely missed. So annual visit is can sometimes be the only solution. So as I told you, a woman goes through these series of changes that is called a menopause transition. Very early menopause where periods are regular but your hormone level starts falling. Then sometimes, as you age, the periods may start becoming irregular. That means you've entered your menopause transition and the cycle length increases from 2 months to 3 months to 4 months, and finally when you stop period, that means you have entered menopause. So menopause transition is hormone levels and the period may last for 5 to 6 years. What are the symptoms you may face? Weight gain, loss of libido, your swings, hot flashes, night regular periods. Hot flashes means even in very, very temperatures of AC, you're feeling hot, you're waking up at night with a lot of sweat, your hands, palms, and so feel hot. So these are the some symptoms, and urinary infection also is very common in during this phase. So finally, when a woman attains menopause, is it a happy pause? Happy, oh, finally I've stopped this period, but actually it is not happy. Your periods were good for you. The estrogen which is produced by your ovaries is very important for your heart, your bones, your muscles. But menopause is of women's reproductive life. It is inevitable, but it brings to us some risks, like risk of heart diseases, risk of stroke, osteoporosis, where the bone just empty themselves. They cannot deposit the calcium inside, and so osteoporosis related bone fractures are common in women of in menopause after menopause. Incontinence has already been discussed, and vaginal and urinary infections are also commonly seen after menopause. So how do you manage menopause? There are menopause specialists aware. First of all, accept it. It is a natural thing which, and the more smoothly you go through it, the better. Some women go through a very smooth menopausal transition, but some women are rarely affected. So some natural methods, as we told you, good diet rich in fiber, iron, calcium, phytoestrogen, plant-based estrogens which are present in foods like soya should be taken, and which gives you natural progesterone. To go through this, then soya, tofu, spinach, broccoli, curd, these are all rich in calcium and should be included in a diet for women who are above 40. Exercise, as I told you, is a very important part of managing your health after 40. Strength exercise, weightlifting, as you see, lift the weight, because muscles are supposed to lift weight, and if you're not using your muscles, they will slowly atrophy and lose their strength. And that is why you see the women who are just waddling like a duck, because their leg muscles have weakened. So before you develop these changes, ask your mothers, ask your sisters to do exercises. Supplements, vitamin D, calcium, and mineral supplements can be given, and pharmacological treatment like HRT can be given according to the situation and on doctor's consultation. So menopause, as I told you, the average age is 46, and sometimes the menopause occurs early. If it is occurring before 40 years, and late menopause is after 50. So after menopause means when you have not got your periods for 1 year. That means you have attained menopause. Any spotting, bleeding, vaginal discharge needs evaluation. Many women, they come to us with irregular cycle, and they just keep on taking medicines to get period, but actually they are going through menopause, and we just artificially giving them medicines to get periods. That is not what is supposed to be done. We are supposed to treat the not supposed to treat their periods, but it is supposed the menopause needs to be managed. First of all, it needs to be diagnosed, and then it needs to be managed. So only getting periods and thinking that you are not attained menopause is not the answer. So, what is the crux of everything? Understanding your health, your age, and what are the requirements at your age is very important. And identify any problems. See, by the symptoms, you will not go to the doctor. So, identify that you have some problem and then treat it. So, women are often ignored. They think, okay, no problem, I will get all right. But do not ignore your problems. If you treat and diagnose them on time, they can be treated. Just like osteoporosis. If it is diagnosed on time, prevented, the side effects, the fractures can be prevented. But after you do the fracture and then you treat it, it's too late. So my mantra is understand the problem, identify, and I hope this session was, and thank you so much for. I didn't take much of time. I didn't make very busy slides, because the smaller the message, the easily it is received. So I think
Yes, ma'am.
I'm
So due to
I,
technical issues, Dr. Shravani is not able to join. So hello, I'm Dr. Meenal. I was there in the
yeah, yeah.
presentation, ma'am. I heard your entire slides. First of all, I wanted to say it is very clear, concise, well organized, and very impactful, and it's going to be very informative session through the slides what you
Yeah.
were trying to explain our viewers what the questions they must be having in their mind. So entire, like as our topic suggests, from teenage to old age, we have covered n number of things, from the health concerns of the girls during their puberty, as you have mentioned, in the initial phases. Then we come as a healthy menstrual habits what they have, then vaccination periods, what are the vaccines available and important for the girls at various stages of their life. Then, ma'am, we understood about the hormonal changes, what happened during this different stages, as you were mentioning it. What are the
Anything,
gynecological issues what we have, how we have to address them in early 20s and early 30s.
anything anybody wants
So,
to ask something in their
yes, ma'am.
mind,
There are
with
many
their
questions
daughter.
in the chat box. I just wanted to address them on behalf of them. Ma'am, there's a question. What is the normal for a menstrual cycle? How heavy should periods be and how regular it should be?
See, first of all, cycle between 21 to 35 days. First of all, women don't even know how to calculate a cycle length. So, day one of your cycle is the day you start your period. Okay, that is your cycle starting. Many women calculate it from cycle end. The cycle starts the day you get your period. So First cycle length is from one period to the starting of another period. So that gap 21 days, not when the period stopped to the starting of the new cycle. So even if you're bleeding for 15 days, but starting your period in 21 in 28 days, means you started your period on first and you got your period on 28, your cycle length 28 days. So this is a very common mistake. So the day you start your starting of your cycle. So any cycle, if the starting days in between the two cycles is less, you're getting two periods is considered as abnormal. Okay. So normal
Yes, ma'am.
menstrual cycle length can vary from 21 to 35. Cycles are less than 3 weeks or more than 5 weeks, then you should consult the doctor. Amount of flow, see, varies from women to women. As a younger girls, they bleed little heavily. So we calculate average day from. If you're bleeding more than 5 days, same amount of heavy blood, then you should meet the doctor. Generally, the flow is for 2 to 3 days, and last for 2 days, the flow reduces. If you're not seeing reduction in the flow, all the 5 days you're heavy, then you should.
So, ma'am, another question what they have mentioned is like what age should mammograms and breast cancer screening start, especially if there is a family
See,
history.
if there is a family history of breast cancer, see, family history means there are two types of cancer. Cancer is one is genetic, where you have inherited unhealthy gene from your parents. These cancer they present early. And second is age related cancer, means your mother, your grandmother developed cancer at a late age because of aging. So if it was an age related cancer, then you may not have inherited that unhealthy. But if there is a genetic cause for the cancer, means you have inherited a defective gene from your parents, it starts screening at an early age like 30. But if there is non-related to the, if somebody has cause of old age, your grandmother or your maternal grandmother, then you start screening from 45. Okay. The recommendation is to start after 45. But if you are if you have any history, then you start from 40 every two
Okay.
years. If the
Okay.
scan was
So that,
normal, if there was some abnormality, then maybe earlier.
yes, ma'am. Ma'am, what is the most fertile age for women and when does like fertility decline? They have this question.
Yeah, as I told, fertility is for women in their 20s. And as you go towards 30, the fertility, the graph of fertility goes down. So once you cross, you are fertile, but your peak fertility is reducing. So chances of max conception are maximum in your 20s.
Ma'am, as you mentioned in your slides, also like hot flashes will be there during the menopause. So there is a question in the chat box saying that what are the treatment options for this?
See, if the woman is getting hot flashes, that means there are called vasomotor system. That means your blood vessels are responding to the lack of hormones. So there are pharmacological treatment, and these changes are seen immediately after menopause. That means if the woman has attained menopause within 1 year, these symptoms will start, or even before that. So there are pharmacological drugs available, and these symptoms are very bad for a woman, and she really feels bad, and she should be treated with the help of drugs. No amount of reassurance will help her. I have seen who have really suffered because of hot flashes, and hot flashes is one of the indication for hormone replacement therapy. Hormone replacement therapy is one of the option which can be given to a woman who is facing that.
Definitely, ma'am. This treatment options are easily available nowadays, and they should be taking the help of the gynecologist and
Yes, yes.
doctors that they can come forward and consult
Yeah, see,
regarding this.
provided they come forward, we cannot treat them. See, your mothers maybe suffering, being drenched in sweat, she may not tell you, right? She may be feeling hot, she may be feeling a lot of mood changes, irritability, not able to sleep at night. These may be the symptom of menopause which she may be going through, and you fail to recognize them. And so if you identify them only, then only you will ask for treatment. So identification is very important, then only doctor can treat it.
Yes, ma'am. Ma'am, they're asking, can we exercise in the pregnancy? Like, what kind of exercise they can do?
See, there are antenatal exercises available, but you have to do after consulting, not generalize them, because every woman is different in pregnancy. If you're having twins, or there's a placenta previa, or there's a bad obstetric history, we should not generalize. So only after consultation with the doctor the exercise, but normal exercises for your back, your pelvis, you can do if your doctor gives you clearance. Every case has to be evaluated. We cannot generalize, but exercises can be done.
Yes, ma'am.
Simple walking, climbing the stairs, squatting, all that can be done. No issues.
Ma'am, there is one question from a school girl, I think. So her mother would have put this. My mom says not to touch the pickle during the periods. What is the actual reason behind that, doctor?
Nothing like that. It is a misconception. They can eat whatever they want.
Okay, ma'am. So with this, we will be concluding today's program. Thank
I
you for
have one
all being a
question
part.
here. What are the vaccine for protecting women across different life stages? See, especially for women, are HPV vaccine, as I told, cancer vaccine, and should be given to both girls and boys, because HPV virus, the carrier is the male sperm. So both boys and girls should be given this vaccine, and only one vaccine for women. Rest all vaccines are generalized. During pregnancy also you may be given DPT vaccine, flu vaccine, but they are all common to male and female. So only to females is HPV vaccine. We don't have any other vaccine for protecting women's health as of now. Your company develops some new vaccine.
Definitely, ma'am. Uh, yes, ma'am. So the answers you have given, I think so they will clarify and they will clear the questions what they have in their mind, our viewers.
Yeah,
So this was very informative session, what we felt, and thank you for
I
being a
hope I
part
didn't
of
take much
that.
of the time. It's
No,
lunch.
ma'am, definitely the information you were sharing that was more important. So it was very wonderful to have with
The
you,
only
to
message
have us
I
with
would like
you. Uh,
to give is that there are so many hospitals which take care of women during pregnancy. All the hospitals are dedicated to mother and child. But what about the women after childbirth? Nobody takes care of women above 40. So, responsibility as a woman to take care of ourselves, to take after 40, because if you're a healthy, contribute to your children's life. But if you are unhealthy, suffering from joint pain, backache, you won't be able to contribute and your life. So after 40, it is woman's own responsibility to take care of herself, because nobody is going to come to tell you do this or do that. So eat well. Nutritional demands changes with age. Guys, take out some time. Do not be shy. I have seen women wearing salwar kameez coming to the gym. If even if you are overweight, don't be shy to go to the gym, because we do some weight training. Even if you are at home, please, YouTube is now freely available. Upper body exercises. Eat healthy, take care of your health, and go for. We don't even ask your
Definitely.
mother that have you had a scan. Have you had your brain time to detect breast cancer? So what we are dealing with is the diseases. We should pick them early so that we have healthy mothers and grandmothers. which are an asset to the society.
Definitely, ma'am. And if we are wealthy, we are healthy, then only we are able to take care of others, as you have mentioned. So first
Yeah,
take care of yourself before others, what we
yeah.
will take the message. So we hope today's session was very informative and valuable in spreading awareness on the topic teenage to old age. Our special thanks to Dr. Shalini ma'am
Thank
for
you.
sharing her time, expertise, insights with us today. For those who would like to revisit the program, the video will be available on our official social media platform. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word to as many as including your friends, families, and relatives. Thank you so
Thank you.
much, ma'am. Thank you for your presence and thank you for your valuable time.
Thank you.
Until we meet in our next live talk, stay healthy, stay aware, and please take care good of yourself.